Good afternoon and welcome to our next edition of the Bellarmine College of Liberal Arts in Action. My name is Dr. Deanna Cook and I'm the Director of Engaged Learning for the college and also Assistant Clinical Professor in Psychology. This series was developed over the summer to give us the opportunity to really showcase the phenomenal faculty and staff that we have in the College of Liberal Arts and here at Loyola Marymount University. So for some folks, this will be a connection with colleagues and friends. For others, it'll be a reminder of the great work that you saw as alumni while you're here. And for others, it'll be an introduction to our faculty and the work that we do. So welcome. I want to let you know that we are continuing to add workshops, and so there is a new workshop that will be happening with Dr. Maura Ford on September 14th at noon, and she's going to be talking about the COVID-19 pandemic and the burden of social isolation. Please note that today's presentation and all presentations will be available on the Bellarmine College of Liberal Arts website and the Liberal Arts in Action. And you can register for any upcoming workshops at that site as well. Today, I have the distinct honor to introduce Dr. Enos Kelly from the Department of Economics, talking about the hidden health costs of a pandemic. Dr. Kelly is a faculty member in economics. She holds appointments in the National Bureau of Economic Research and USC's Schaefer Center for Health Policy and Economics. Her primary fields are health economics, labor economics, and public policy. And she has served as a co-editor in chief of the peer-reviewed Elsevier Journal of Economics and Human Biology, and is the co-editor of the Oxford Handbook on Economics and Human Biology. So I'm going to turn it over to Dr. Kelly. Thank you so much for being with us.
Thanks so much for inviting me. It's great to be part of this series. I've attended several, and I'm looking forward to hearing about COVID from the perspective of a psychologist on September 14th. So let me share my screen. Okay. All right, so I'll be talking today about the hidden health costs of a pandemic. And I'll start actually by taking a look at a question that I asked my econometrics students in the spring. And I asked them, we had just started, the shelter in place order had taken place. We were online, we transitioned to learning online, and we'd started nonlinear models. And so I had them think about, and we discussed the effects of days at home on predicted health, and not including COVID. So clearly, if you measure health, or as say the probability of contracting the coronavirus, then days at home would decrease that probability at an increasing rate. But I wanted them to think about the mechanisms through which days at home would affect other forms of health. I was concerned about this, as I'm sure many of us were from the very start, and sure enough, other forms of health have deteriorated as a result of the necessary shelter-in-place orders. So I had them think about the mechanisms, and these were some of their answers. I thought it was good they were thinking about these issues, but their answers also show how maybe college students might be thinking about the mechanisms differently from other people. And so I added the ones in purple, but so some of them said, well, I would expect the effect to decrease health at an increasing rate, decrease other forms of health. And others said, well, I'd expect it to increase initially, but then when days at home go up substantially, I'd expect it to eventually go down. And some of the mechanisms, so one of them, right, a beneficial effect, lower likelihood of contracting viruses in general, so other viruses. Initial time at home is time to reset and a welcome break. So some of them felt that way. Opportunity to do different creative things. So I did like some of their answers. I added, so this was maybe the case for me, positive, more time to bond with family. Not all students felt that. Some felt it was perhaps perhaps had a negative effect. Social isolation. So family structure is going to play a very big role. Are you alone? Are you quarantined with family? And so on. So social isolation is definitely a big one. Lack of fresh air, lack of outside exercise, especially initially. We were told not to go outside. We were told to stay at home. And so initially, many people didn't go outside. Boredom, they cited. Not enough fresh fruits and vegetables. People were hoarding packaged goods and actually not buying enough fruits and vegetables, perishable goods. And there was kind of a plea because fruits and vegetables were piling up, and this is one of the things that affected supply chains, to buy fruits and vegetables. Stress and anxiety, as we know, stress and anxiety about the virus, stress and anxiety about uncertainty with the future, financial uncertainty, and this will increase cortisol levels, which can trigger a host of particularly physical health problems. I was especially concerned with people putting off seeing the doctor, and I'm sure I know a lot of other health economists who are concerned, and then people in general. A lot of people were putting off seeing the doctor. Cancer screenings went down, just wellness visits went down, but even seeing the doctor for serious comorbidities, that went down as well. And so that's a big concern, and we still haven't seen all the consequences of people putting off seeing the doctor during this period. Also, lack of stimuli from different environments. People are starting to travel, but people are still not traveling like they did before, and just not being in many different places, while again it was necessary to contain the virus. So all of so the shelter-in-place orders, I'll argue, were necessary, but they have unintended consequences, and I think we should be aware of these unintended consequences in order to mitigate their effects. And so I'd like to ask I'll circle back to this at the end, to think about what's one way, and I'm sure you've thought about this already, your health has changed since March, so your physical and or mental health. What's one way it has improved, and maybe what's one way it has worsened? And this will also help me think about the mechanisms, and as I explore the inequalities also that have arisen through this pandemic. And so these are all interrelated. These are concerns for everyone, I think. Health, the economy, and education. And so in terms of the healthcare system, often health economists think of the healthcare system in terms of a three-legged stool: access, affordability, and quality. And for the most part in the United States, we know that, right? So yes, we're pretty good in terms of quality, not great in terms of access or affordability. And I think those the fact that the healthcare system was, as it was, fragmented from the start, made the response much slower than it could have been. We were ill prepared for this pandemic. We have a multi-payer system. Those countries with centralized systems, single-payer systems, combined with an effective leadership that listened to scientific evidence from the start, from the get-go, did have much better results and are able to reopen quite extensively now. Our systems based on the majority of people who have health insurance have employer-provided health insurance, and a lot of people lost that insurance through losing their jobs. And so this heavy reliance on employer-provided health insurance is an issue. They're able to eventually switch to maybe insurance with higher premiums, such as COBRA, and insurance through the ACA marketplace. But this is still this is a big concern because not everybody will be paying higher premiums as a result. So initially, especially, there were huge capacity constraints, right? We didn't have enough hospital beds, ventilators. You see the situation in New York City, where I moved from 2 years ago, right? So there were lots of deaths as a result of these huge capacity constraints. We're still not where we want to be with testing, unfortunately. We're getting somewhere with vaccines, and we're getting somewhere, well, not as much, but we need to spend more time thinking about treatments which are equally, if not more important in some ways than vaccines. In terms of vaccines, the incentive structure needs to be there for researchers, for scientists to develop vaccines when we don't have a pandemic. We shouldn't have to wait for there to be a pandemic and then rush. So obviously the process usually takes years. Now it's kind of being rushed with phases being allowed to overlap, and testing happening earlier than it would normally happen. And now there are 2 vaccines in the making, 2 very limited, approved for very limited use, coming out of China and Russia. But there is hope that there will be vaccines. Once it comes out, people need to take the vaccine in order for it to work, which is another concern, of course. Mental health concerns and physical health concerns that I cited in the previous slide. And I like this quote. It's an unfortunate one, but the pandemic didn't cause healthcare inequities, it exposed them. And so what do we see in terms of outpatient visits? So is it true that people are putting off seeing the doctor? Yes, they are. So this line represents March, and suddenly outpatient visits plunged. They're starting to come back up. But of course, in some cases, especially when it comes to things like cancer screenings, we want to make sure it's not too late. And so people did put off seeing the doctor. Deaths were above normal. So some of these are underestimates. So COVID deaths are more likely to be slightly underestimated than overestimated. So some of these might be due to COVID, but most of them aren't. And so these are the deaths above normal that are not related to the coronavirus, starting March. And so before March, we were actually doing pretty well. We were below normal, so which suggests that these might have been right. So it's even higher than expected. And so we see more evidence that non-COVID deaths have increased in terms of heart disease. So we see this with heart disease. We already see this with diabetes, cerebrovascular disease, Alzheimer's. And so these are effects that we've seen right away, and we might still see some longer term effects with things like malignant neoplasms, cancer. So we're waiting to see that. Where are we today? And I kept having to update the slide. This is as of about an hour ago, so we're at about 23 million cases worldwide. We noted a few days ago, we surpassed the 800,000 deaths. Cases in the United States, 5.7 million deaths, almost 177,000. And then I cite for California and New York the cases. Now we're always looking at cases and hearing reports about cases, but that can be very telling in terms of where most of them are, where the clusters might be, but we really should be looking at per capita cases, right? And even though, yes, United States has about 4% of the world population, but is responsible for about a quarter of cases and a quarter of deaths, so we're high up there. But per capita, we're not the highest, we're high, but it's telling to look at cases per capita. Now, California, in terms of just comparing, I like comparing California and New York because I used to live in New York. And so in terms of per capita, California has about twice the population as New York. It's the country's largest economy. So per capita cases are lower considering that than in New York. And I know New York is looked at as an example now. They're very gradually starting to reopen, but they also suffered a lot of deaths as a result. And yet deaths here in California, where we were the first state to close, to impose this shelter-in-place order, we actually have fewer deaths. And while cases are, we're starting to rise, we're in the past couple of weeks, we're actually experiencing a slight downward trend. But while cases were really going up in California for a while, at least because it's happening later, the healthcare system is better able to respond. It is also, the rise in cases is also happening more among younger people, which which might translate, right, in the future. We'll see this into more cases among older people. And so globally, these are per capita cases. Of course, the United States is up there, but in recent weeks, we're seeing, in recent, especially days, we're seeing Mexico, Brazil, Peru, Chile, all of these are experiencing really high cases as well. Just a few days ago, so if we're looking at California, the green represents were a downward trend in the past few days, and the greener it is, the better the downward trend. And this, I got this a few days ago, and just today, right, it's even greener. So there's more of a downward trend in per capita cases, in new per capita cases in California, which I think offers some hope. And so so here, this shows cumulative cases over new cases over time and cumulative cases. But this also shows when restrictions and closings, again, we were among the first in the United States, but then reopenings, right? So it's been shown that reopening can send a signal to people so that things are okay. So people were, when we reopened, they were taking fewer precautions. And the idea was to reopen, but still take a lot of precautions, still take those non-pharmaceutical interventions of social distancing and wearing masks very seriously. But it did send, apparently it's been shown, it did send a signal to some people that things were okay, even when they weren't. And so I feel like from the beginning, and I've teamed up with a cognitive scientist to try to, again, examine what's happening, but from the beginning, information wasn't very clear, even from the CDC, right? Initially, they were telling us not to wear masks. And so from the beginning, people were turning to citizen science. There were a lot of Facebook groups and Reddit groups with scientists informing the public. And more and more people were going to these groups to seek information because they felt they weren't being informed maybe properly. And so that goes back to, those with leaderships that for which, the individuals, the population trust their government, trust the information they're receiving, had much better responses in general. Just to show a snippet of the heterogeneity, just looking at searches. If you look at the vote share, current president's vote share, and just searches for the coronavirus, you see that you see this negative relationship. So this can, I won't talk extensively about the political divide, but there is a huge one, and that can definitely, and the heterogeneous population can definitely stop or slow down progress at getting at this virus, and also economic progress. So some issues, right? From the start, I thought a big issue was the lack of random testing. It's the biggest policy failure. So, I said this to students in April, and it's still the case that we're not testing enough, unfortunately. The asymptomatic rate, it's still not well estimated. By actually testing randomly and testing as many people as we can also target social distancing more accurately so that we can reopen more easily. And that hasn't happened still, and and we're still far from being able to test extensively. In economics, we like talking about negative externalities. It's very, right? So with negatives, it's just a negative spillover effect. Infected people don't fully internalize the consequences of their decisions on the spread of the virus. This is, again, especially true of younger individuals who may not take those non-pharmaceutical interventions very seriously. A lot of us have been relying on epidemiological models, but that might actually overestimate the spread. And a lot of economists say we should be looking at economic models that endogenize behavior. People were responding even before the shelter-in-place orders. People were taking steps to protect themselves and to protect others, but even before any kind of restrictions. So behavior changes in response to news of the virus. So are we testing enough in California? We are not, right? And I'm just to compare, in New York they are, but the targets are different for each state because their rates are so low now. Their target isn't very different from is much lower than that of California, even though their testing is pretty similar. So so we do need to improve the rates of testing. And then if you look also by socioeconomic characteristics, those being tested are those with, who tend to be those with higher incomes, those obviously with good health insurance, and so on. And so these are concerns. So looking at groups disproportionately affected, and everyone, this is not only a that the virus itself is very heterogeneous, but the way it's affecting everybody is very different as well. So those, right, low SES, low income, low education, those are being disproportionately affected negatively. Minorities, so both Blacks and Hispanics have higher rates of COVID deaths. Females, I'll talk more about females as it relates to the labor force and how they're affected. But those with little internet access or fewer technologies, so there's this digital divide, and this is especially the case, for example, with those who can work at home. In general, about 37% of jobs can plausibly be performed at home, and those doing those jobs are those with at least a college education. In terms of schools, which I'll get to, those without good internet access are suffering who have with their kids with remote learning, and so these issues are really big issues. Because we hope that public schools, right, should somewhat level the playing field, but once they're learning remotely, then that's been reversed, and so that's a big concern. So those, right, some independent contractors and those in the gig economy are being affected, and clearly older individuals are being affected. And so I just want to turn in terms of, we get all these messages about what to do, shelter in place, assuming that you have the right home environment, and many people don't. So the WHO, the World Health Organization, said that you will have a good home environment to shelter in place and to be able to deal with the virus if you are able to receive reliable information easily, if you're able to social distance and lock down, if you have suitable, right, facilities, and in many developing countries that is not the case. And if you have access to medical help, and here, unfortunately, here in the U.S., that's not the case for many people. And so one study found that in the world, 90% of households have inadequate home environments for protection, according to these guidelines. Okay. In terms of age, we know that the older you are, the more vulnerable you are when it comes to this virus. But it's really, it increases at a right, exponential. It increases really, right. So once you hit 65, the chances of the infection fatality rate going up are substantial. And so, I've got a couple more slides looking at age. Here you're looking at the mortality rate. From February up until around now, but you can see that consistently, except for in this area where they're about similar between the 75 and 84 year age group and 85 and older, but you can see how much higher deaths are for those, especially 85 years of age and older. And this shows just how much higher it is, right? So 600, right? So you've got 600 and 30 times higher death rate for those in the 85 plus age group. Okay, just put this back here. I like this because this summarizes, this is from the CDC, and it summarizes, right, the things that'll increase community spread and individual risk, right, crowded situations. So many cases can be linked through contact tracing back to clusters of individuals, close physical contact and closed spaces. So it's actually, one study found that indoors, your probability of getting the virus is almost 20 times higher than it is outside. And then duration of exposure, and then so viral load has a big role. So it's not just black or white, whether you have the virus, but exposure to the virus, which is why even young healthcare workers are particularly vulnerable. Okay, so in terms of the economy, there was an inevitable trade-off between the severity of the recession and health consequences of the epidemic. But there was a lot of there were a lot of economists saying that there was strong rationale for action, for strong action now. So social distancing and containment, really strong containment measures from the start, which we do see right in countries like New Zealand, which are doing very well now. So very strong containment measures from the start, and then you see better outcomes later. And that calculating, taking the economic costs of lives also into account, that you definitely don't want to reach a point where there's herd immunity, because the deaths will be too many, and so you do want strong containment and good economic policies to mitigate the effects of a recession, good federal responses to mitigate the effects of a recession. In terms of testing and ideal quarantine policies, if we test extensively, then we can release those who aren't infected and fully quarantine those who are. Now, in terms of those who, and possibly release those who have been infected, although there was the first confirmed test just yesterday, I believe, of someone being reinfected over 4 months after they were previously infected. Now, in terms of the unemployment rate, we see that that's gone up substantially since March. So this is so March, and we see that's gone up. It's gone down a little bit, but it's sort of leveled off. And a part of that is federal response, which I'll get to, which makes a big difference. And a part of that is leaving the labor force. So if you look at the actual labor force, which includes both those employed and those unemployed people, that's gone up slightly. And so a part of that, and that could be due to discouraged workers, or simply some argue the checks they receive to help them, exit the labor force, which I will get to. This quote unquote possibly recovery is actually leveling off now, and we have yet to see what might happen, especially as federal aid goes down. The employment change by sociodemographics, you see that especially the 21 to 24 age group, and Hispanics are disproportionately affected, and a part of that is the type of work. So some have heard, well, stocks are, look at the recovery, stocks are going up, and the S&P, 500 index is looking good. First of all, it's not a brilliant measure of the economy or how the average person is doing. Actually, some look at the WEI index instead, but this actually isn't even a reflection of how the average stock is doing, because most stocks are actually not doing so well. This is being driven mainly by 5 companies. So you've got Amazon, Alphabet, Google, Facebook, Apple, and I always forget the fifth, Microsoft. I shouldn't forget Microsoft, So this is driven by by these companies. And so we're not necessarily seeing a recovery. And so just going back to this for a second, some are starting to talk about, so you've heard of maybe a V-shaped recovery or a W-shaped, right, recovery where you're going down and up and down and up. Well, now they're starting to talk about a possible K-shaped recovery, right? So where you're dipping down, and what this means, right? So some people are doing really well, but others, right, are really not, right? So you're seeing, and which is reflective of, well, some stocks are doing really well, others are really not. You see that with the labor market. Some are doing, right, great, others are not doing great at all. You see this also with the housing market, right? So the housing market, it's looking pretty good for some. At the same time, you look at things like mortgage delinquencies, especially among those with lower incomes, going up, and you don't, evictions will likely go up too as that moratorium is lifted. And so these are big concerns, and also to do with the measures of the economy. So this, I like this graph because it shows, well, the containment policies will help lower the number of cases and lower the number of deaths, right? So, but, right, so what happens to GDP, right? So with the containment policies, yes, there's going to be a recession, but with economic policy, and again, response from the government, it mitigates the ill effects of a recession. So kind of like this somewhat optimistic graph, which takes us to the CARES Act, and other federal responses. I know there are others being talked about, HEROES, but nothing has quite replaced this act, which for many segments of the act, not all of them, for many segments of the act expired at the end of July. So it was passed at the end of March. The economic impact payment gave a lot of people, right, those earning less than $75,000, $1,200 each. Those were joint filers earning less than $150,000, $2,400, with $500 additional per child. This was supposed to boost the economies. One study said, well, 15%, only 15% was spent. 33 of only 50% of individuals receiving it spent most of it. 33% saved it. 52% used it to pay down debt. And yet these numbers are the numbers for spending. The percentages for spending were higher among low-income minority individuals, and those who receive, and also those who received smaller payments. So there was also the federal pandemic unemployment compensation of $600 a week. So that added to unemployment insurance, but this ended at the end of July. Now, this has been shown to have, for many individuals, actually covered all, and sometimes even surpassed, of their previous earnings. And so this was viewed by some economists as a disincentive to work. And so my argument is, if it prevents, right, a vulnerable person from contracting the virus, if it slows the spread of the virus, if it keeps that essential worker from leaving her young kids at home alone, if it reduces financial uncertainty in the future, then that's a good thing. It's we shouldn't be. This is a different kind of a recession, and we shouldn't be looking at something like this as a disincentive to work, if working right now temporarily is not the optimal thing to do. And so hopefully, in order to see these possible recoveries, hopefully something will replace it very soon. So in terms of our heterogeneous response, the role of family size and structure, right? So families with children are really experiencing this differently, I think, from families without children, and also those who are alone. So everyone's having a very different experience. But when the shelter-in-place order first came about in March, suddenly working parents needed to work and manage remote learning for their children, and just balance having them there all the time because they couldn't get child care easily because you need to social distance and quarantine, and not interact, especially in the beginning. Other families disproportionately affected, extended families with older individuals who are at greater risk. According to one paper by labor economists, married couples without children are faring the best under this pandemic, although there is some preliminary evidence of more domestic violence calls. So that's another obviously big concern. Okay, so I like graphs. Looking at these simulations, I think there are a few simulations here and in the next slide that look at females in this type of recession. So females are disproportionately affected partly because a lot of them worked in the service industry, and a lot of them have childcare needs. And so you see in terms of ratio of hours worked between women and men, you see that's really gone down. And in a pandemic recession, it's going to be worse than in a regular recession. Now, you might actually see for a regular recession that might affect males more. So in construction, manufacturing, technology, if they're unemployed, if they become unemployed during a regular recession, the spouse, right, can actually step in and work. But in a pandemic recession, that's not really the case when there are childcare needs. And so just looking at, right, without kids, a regular recession versus a pandemic recession, you've got very similar simulations without kids, right, for the two types of recessions. And with kids, you get huge differences in terms of weekly hours worked. Again, so singles, you get, these are actually, you just start at a higher number of weekly hours worked for the fathers, but it's similar, right? In terms of single parents, it's actually a similar dip in a pandemic recession. But with married couples, what's interesting is that the mothers are disproportionately affected. Okay. All right. Again, to continue with parents, right? Single parents, married mothers, married fathers, in terms of weekly child care hours. You see that the child care burden disproportionately falls on the mothers, as you see here versus here. Okay. All right, and then the last part of what I wanted to talk about, so this kind of leads, kind of a segue talking about parents into schools and reopening. We're not in a great position to reopen, but in Los Angeles County, we might be ready, and looking at a school, for example, that has about 500 kids, which is similar, my daughter's school has 600 kids, about 4 people might potentially be infected if you go, if you reopen schools now, and therefore they might spread the virus. I do like this map. It really says a lot. So we're, right, so if you look here, if it's a school of 1,000, you have 8 people who might potentially be arriving during the first week of instruction with the virus and might spread it. So there's that fear. So we haven't reopened yet. So my daughter will be starting remotely in 2 days. They canceled preschool here, so my son, 3-year-old, won't be starting. But I haven't heard, so when parents asked, well, what about outdoor classes? I feel in California, we don't have much of an excuse not to have outdoor classes. It's, it hardly rains, nice weather all year round. In New York, the mayor just, in New York City, they're going to start applications for, so where the weather isn't as nice, they're going to start applications for possibly having outdoor classes. In the school district here, they were talking about the logistics, how you have to go through a lot of hurdles and approvals in order to have outdoor classes. My argument is do it. It makes sense. If viral transmission is that much lower outside, then it really makes sense to prioritize doing this. And the American Academy of Pediatrics and also the National Academies of Sciences, Engineering, and Medicine both came out with reports saying that especially for elementary school children, it's the long-term effects of social distancing or not interacting, at least in some ways, with other children is going to have long-term effects. And so and there's again that problem also with inequalities in education being exacerbated. And it's been, some evidence has shown that, for example, STEM, the differences in STEM learning between those higher socioeconomic status families and those with lower SES is really widening. And so these are all reasons to try to safely reopen schools sooner than later. And just as an example of higher SES, you've got some wealthier families creating homeschool pods and hiring private teachers, which is very expensive. And yet most people are not in a position to do that. In the future, so we need funds for expanded testing, vaccine timing, and whether people take it. Of course, obviously you can have a vaccine, but if people don't take it, then it's not very effective. So behavioral responses are very important. Available treatments, and I can't underscore the importance of federal and state economic responses and the political environment, right? So just in terms of the vaccines, we've got, again, like I said, 2 in early approved for limited use. In terms of treatments, more work needs to be done on this end. We have 2 possible ones, and that many that have tentative or mixed evidence. I know blood plasma just recently was approved for use in many patients, but it hasn't really been too effective in many patients. But I know the current administration is citing this approval as new ways in which we're effectively conquering this virus. The 2 widely used are ventilators and prone positioning, which help mitigate the effects of the virus. So I would like to ask you, and you can either respond in the chat if you don't feel comfortable, or I'd like to hear from you in terms of your health since March. What's one way it's improved and one way it's worsened? Let me stop sharing my screen. And this could be physical or mental health. Okay, less stress. That's great. Okay, improve by enjoying walking more. I really love that. I'm going to write these down. More time to exercise. Elizabeth, more stress, right? Yes. Even worse, insomnia. Yes. I would have to agree with Elizabeth. Spending more time with family. I agree with you, Janet, too. That's actually. I hear from many, and actually I've heard walking is one of the best things. Walking every day outside is one of the best things you can do these days. And I'm glad to hear that a lot of you are doing that. Right. So some of you, Swaroop, you were relying on going to the gym. Yes, not being able to access the gym is definitely, right, had ill effects. And especially, so a lot of you are talking about, yeah, with exercise. Exercise has huge, not only physical health benefits, but huge mental health benefits, and they're intertwined. So many things are psychosomatic, right? So we really do want to take care of ourselves. Too many people, I think, have been neglecting their health. And things like teaching, I feel I I love walking around when teaching, and that's just not something we're doing these days, right? We're teaching while sitting down now. So maybe some of you are teaching while standing up. I don't know. Right. So more connection to some family, but disconnected to others. Yes, absolutely. Right. So less commuting stress. Started to bake more, gained 6 pounds. Yeah, so some people have talked about the quarantine 15 or the COVID 20, and ways in which that's right affected our body mass index. That's great. Less fast food, cooking more, eating more healthily. Right. So notice, right, those who have young kids, especially, right, worrying about kids and school and work and balancing everything. I know for me, at least, initially we were relying sometimes on having help from some older family members who just cannot help at this time. Right. Of the ways I can exercise in my own home. Be curious to know if you want to share, Victor, what apps if you use apps, ways of exercising at home. Obviously, it doesn't have to involve apps. Okay. Connecting more with my teenagers. I love hearing that, because I have a friend who says she doesn't see her they're in their rooms and doesn't see them, which is very unfortunate. Less meat and more beans. Right. Worried about my 13-year-old daughter's limited social interaction. Okay.
I just decided to come on screen because I think you're available if anybody wants to actually speak. So I would just say that I have more opportunities to walk, but I still exercise less.
Right.
I'm not moving nearly as much as I typically do.
Yes. Thank you, Deanna. I actually feel like we don't realize how much we move on normally. I don't, so I'm trying to get exercise in, but I still don't feel the same way I did when I went in to work regularly. But how much I walk at work, right? How much I walk when I teach, how much I move. Those are, yeah, not things that you can really compensate for at home. Okay, well, I think I can save what's in the chat, or it's being saved. Is that correct, Deanna? And Janet, thank you so much.
Yes, sorry.
Having my desk 20 feet from my kitchen is not good. I completely agree with that. Okay. And again, like Janet said, feel free to turn on your camera and share, but I'm saving these responses. I find them very helpful, and they help me also to think about all the mechanisms as I'm doing my research. And I'm going to start getting my students involved in this research project as well, as I think it's so important and so relevant. Oh, not rushing in the morning to get children to school. This situation, yeah, has been, there's there are a lot of silver linings, I think. I think we can view this as an opportunity to do things differently as well, to rethink the way we do a lot of things. I was hoping it would also be a way we rethink the way the environment, the way we treat the environment. I'm not sure there's going to be much changed on that front, but I'm still hopeful that that we might turn to doing things in a greener way. Okay. Thank you again for having me participate in this series. And again, I really look forward to the next one.
Great. Thank you so much for being a part of this.
Okay.
My technology seems not to want to work so well today, but thank you for being here. Thank you for everyone who joined us. Special thanks to Jeff Hinline, Allison Mullen, and Janet Vera. And again, if you are interested in continuing to participate in our Bellarmine Liberal Arts in Action series, we've got one coming up on September 14th, and we may add some more as well. Appreciate you all. Take care.